I felt that, then medicine was my calling. Is like seeing sick people get better and looking at certain doctors who actually inspired me. And I never could imagine myself doing anything else other than doing medicine. That was like my dream. I've had a case where this orang asli child was brought in literally with a potassium of 0.8. Have you seen that? It's not even compatible with life. So, I was freaking out. I've never seen that before. Everybody had worms coming out of every single orifice you can think of. I'm not joking. The nose, the mouth, the anus. Usually deworming agent is a step dose, right? Not for that. We had this case whereby a guy, a gangster, they chopped off both his hands at the wrist level. Amputation at the wrist. And we had to do a bilateral replantation. We had to connect both the wrists. Basically, it took us 20 hours. We were like a zombie when we came out.
Join Disruptive Doctors.
I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Postcall, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Postcall Beyond the White Coat. So there's a perception in medicine, isn't it, that doctors who stay in the public sectors are the ones who are truly committed to healing, serving the nation, contributing back, and making a difference. And then there's this quiet judgment among the medical fraternity when a doctor moves to a private healthcare sector. Whispers about chasing medicine, chasing money instead of purpose. But stories like yours, Dr. Jeffrey, it challenges that perception in a very, very powerful way. You've dedicated so many years to perfecting your craft, from your early days as a houseman in Kuantan to becoming one of the few pioneers of robotic hip and knee replacements here in Malaysia. And along the way, I'm sure your journey was not easy. It must have been filled with moments of grit, failure, resilience, and perseverance. And I can't help but wonder what ignited this path. So let's go back to the very, very beginning. What made you decide to pursue medicine in the first place?
Hi, Selina. Okay, so medicine per se, I think I always wanted to do medicine from the age of 15. Okay, so in my younger days, I used to watch a lot of actually more of detective kind of movies, all this crime kind of thing and all that. So I always thought I'd either be a lawyer or some kind of crime related this thing. But then at the age of 15, something just got into me that I wanted to do something for people, to help people, like get them better. And then I felt that, then medicine was my calling. Is like seeing sick people get better and looking at certain doctors who actually inspired me and all that kind of like veered me into doing medicine, I guess, from the age of 15. And so when I was after my Form 5, I told my parents that I want to do medicine, and they were very supportive. And so the rest is history. That's what I guess, the drive to actually help people get better and to see the satisfaction after that. That was what drove me into medicine. Yeah.
Was there any particular event that made you decide that medicine was for you?
Particular event? Not like, it was not as dramatic as a family member getting sick and then getting better or something, but it was just I couldn't imagine myself doing anything else. You get what I mean? So at the age of 15, when I thought to myself, like, of course I didn't think that I'm going to become a surgeon or anything, but what I felt was like this deep need to actually discover more about the human body and to learn and all that. So there was no one particular incident, and I never could imagine myself doing anything else other than doing this. And that was like my dream. I always used to think about it. So I just decided like, okay, having this dream, I need to pursue it, So there was no one particular incident which triggered. Yeah, I had a few like kind of like mentors or maybe like people whom I looked up to, had this one of my father's friends and uncles and all that who actually kind of like seeing them, the way they were treating people and people getting better and all that kind of like was a driving factor, I think. Yeah, part of it. But mainly it was the deep desire in me. Yeah.
Okay, you started your journey as a houseman in Kuantan. What was that like?
Okay, yeah. So I was posted for my housemanship in Kuantan GH, right? And back in 2004, I would say it was one of the most challenging, stressful, and as well as exciting time in my career. The reason being, I mean, we used to work like 36 hours, 48 hours straight, and all that. Sometimes with very little sleep. But I made sure I had a good set of friends whom I could rely on. And we used to have our own ways where we could de-stress and all that, so that we come back and we're not like cursing and saying like, okay, this is really a tough thing. I never regretted housemanship or doing medicine, but a lot of my friends did. But I chose to not take the negative part of it and just be positive, because I told myself, okay, this is the learning period. I really need to equip myself with all this knowledge for the future. So let's just, bite the bullet and go for it. That was what in my mind. Although we had very little sleep, a lot of additional work, and but it was an exciting period. I mean, we were exposed to so many different kind of cases and all that. And of course, I had my fair share of difficult bosses and also very, very good mentors who actually guided the path well. So I'm thankful for my housemanship. No regrets there. I had a good time, I would say, overall, learning, suffering at the same time, enjoying myself, Yeah.
Yeah, I guess every experience has its good and its bad. Like, what was the bad like for you?
You mean particularly during housemanship or
Yeah.
just, yeah. Okay, I think during housemanship, that period, that awkwardness of that or that blurriness in that first few weeks and months is really example one story. The first day I was there in housemanship, I did my surgical posting. I mean, the consultant there, I still remember his name, Mr. Kannan. We are still very good friends, I mean, we refer cases each other right now. That's the beauty. But on that day, the first day I came, I was so blur, still finding my way around the hospital as well, don't even know where is what. I followed rounds, and then he said, hey, go and get one ultrasound for this patient, So I said, okay, 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 sir. And then I wrote down the thing, and then I turned and I was walking towards inside the ward, not towards the exit. So he called me and said, where are you going? The exit is that way. I mean, things like, now, first day itself, you already want to go to the balcony already, out, something like that. But, we are good friends right now, and we refer cases each other. He was one of like my mentors who actually kind of like gave me that interest, looking at how he used to operate and see and how the patients get better and how the patients talk about him. I mean, this was all a drive. So it's like these are the people you look up to and say, one day I should be like this. But that blurriness, awkwardness in the initial stage, you don't know what is going on, what you study in medical school, your working time, everything is different. So many things are different. Why are they doing things this way, this way? You're discovering. But over time, you get the hang of it. But I guess another thing is we cannot be calculative with regards to work. I mean, we always what I had good set of friends and good housemanship. Of course, there were the bad apples, but working together, we survived it. So we also can cover a huge ward round and somehow escape to have lunch outside also, which is a luxury as a husband. So these kind of things I would say kind of like shaped our careers.
So it sounds like really for someone to get through housemanship, you need a good group of colleagues and friends
Yes,
and support system to get
definitely.
you through.
Definitely, support system is utmost important. A supportive family is few supportive friends. You don't need many. Friends whom you can go to, especially when you finish that 36, 48 hours shift. Sometimes you actually, everybody wants to go home and sleep. But I mean, if you got a few colleagues, just go out, have a dinner or something and talk some nonsense also, you feel actually re-energized. You share each other's problems, and then you come back next day rejuvenated. You got somebody to hang on to. That time, because most of the time family won't be at the area where you're posted, right? Family is always away, right? But support system is extremely important. Of course, good bosses, I think, good consultants, good MOs who are not toxic, that is utmost important. But of course, we had our this kind of the bad ones who victimize you and all that. But then I just chose to listen 1 year and just let it out and say that, okay, this is part of the journey. I'm going to meet people like this. Everybody can't be like how you would expect them to be, right? People's personalities are different. So I guess you just have to go with the punches, like roll with the punches, I would say. So, but being resilient and being persistent and thinking that there is a light at the end of the tunnel. It's just the career path which you have to take. Yeah.
So was there any doctor or consultant who really made an impact on you during your formative years as a doctor?
Yeah, I would say one of the main guys was my former boss, orthopedic boss, consultant arthroplasty surgeon, Dato Sri N. Prem Chandran. He was a mentor and a guy whom I used to look up to a lot. You know why? Few principles. He was super disciplined. He used to come to work early. Even he's a JUSA. He retired as head of service for the country. Okay, and this guy sitting in Kuantan being head of department from the 90s. And the discipline, the way he talks, his impeccable Queen's English, I would say, and his principles in managing patients. These are the things which impacted me, like even drove me to do orthopedic. And he is an arthroplasty surgeon as well, joint replacement surgeon. So he was one of my early inspirations, I would say. The way he deals with patients. When he scolds somebody, I've never once heard him use the foul language. I would say that, and even not belittling or what. He's firm, he's strict. People are afraid of him. I mean, because of his firm ways, but not in a bad manner. No belittling people, no putting down people, but professionally managing the entire department. And eventually, you see, he was chosen to manage the country. I mean, sitting in Kuantan, not in Klang Valley, a head of service to be chosen from there, it's actually unheard of. But this guy and his potential, so he was like truly an inspiration for me. When I went to district, he was pivotal in bringing me back and getting me into the masters and all that. With his every single step of my way, from the time I MO entered masters to subspecialty, he has been one of my referees. You always have to get two referees. He has always been my referee because he's always been my inspiration, my early inspiration. Yeah.
So after housemanship, where were you posted?
Yeah. So after housemanship, I went to the legendary town hospital Pekan. I was a medical officer there. So my final posting was actually my final housemanship posting. We used to have to do 5 postings the time, all the major postings. So I did orthopedics as 4th posting, and then 5th posting was pediatrics. So the pediatric intensive, what do you call it? The neonatologist was the legendary. We used to call her Mama Chin or Dr. Chin, who is now retired. She is another legendary doctor, one of my inspirations as well. She actually told me, you don't go to district, stay in pediatrics. But I wanted to do surgical based orthopedics. So I said, sorry, Dr. Chin, pediatric is not my thing. And I was posted to hospital Pekan for 2 years. 2004 to 2006. 2006 to 2008. So, that was also another interesting period because you finish your housemanship, you're equipped with everything, and then you're supposed to go and manage everything yourself. There's no senior consultants or specialists. Right now, Pekan Hospital is more of a cluster hospital which has specialists. They have physicians, they have gynecologists, obstetricians, and all that. At that time, we medical officers used to manage everything. from MI even to streptokinase patient, or even delivery, and all the things which you can think of lah. The third stage complications in obstetrics, the works lah. So that one was interesting because multidisciplinary, you manage everything. And I also used to head the infectious control unit. So I used to do other things, go and look at the store and the medicine. I mean, things how they store anything, whatever infection base and all that, And then also when you have a outbreak, because Pekan Hospital used to cover Orang Asli, the largest Orang Asli community. We used to get a lot of gastroenteritis, food poisoning, and all that. So, contact tracing, and when you trace all the source and all that, you have to work with the state engineer and all that, because water source and all that. So, that was an interesting period. I worked with a lot of government, see where the source of the contamination was and all that. So, that was interesting period in Pekan. I would say also an important part in my career, shaping me for who I was, because you're responsible for many things, so you learn leadership.
Were there any cases that stuck with you from back then during
Yeah.
your time in Pekan?
Yeah. They're very interesting case. I've had a case where this Orang Asli child was brought in literally with a potassium of 0.8. Have you seen that? It's not even
Wow.
compatible with life. So, I mean, I was freaking out. I've never seen that before. And then you see, at that point of time, when you're finished and you're a medical officer, okay, inside your mind, you want to correct the potassium to 3.5. But you need to understand the Orang Asli community, their normal potassium baseline is not 3.5. You go and correct it to 3.5, they will die. Okay. So you need, yeah, so that's the truth. So you need to keep it, you might need to slow correct. As you know, potassium, you can't rapidly correct, slowly. And then after that, you can fast correct, but that also your aim would not be, of course, with consultation with the pediatrician in Kuantan GH and all that. Seeing the kid came like a vegetable, literally. Like potassium is low, right? You basically your muscles or everything, so you cannot rapidly correct. But then, okay, it was because of diarrhea, vomiting, basically gastroenteritis, and then their whole family finally came. About 10 of them, everybody had worms coming out of every single orifice you can think of. I'm not joking. The nose, the mouth, the anus. Usually deworming agent is a stat dose, right? Not for that particular. I literally deworm them for a whole week, monitoring the LFT, because the entire family, they were severely malnourished, and the kids, the smallest from 1, 3, every year they got kid 1, 3, 5, like that, small kids, and they were so socioeconomically poor, very in the inside somewhere Orang Asli community. Of course, they have jabatan hal level orang asli all, but some of them they don't want to get out of their beliefs. They don't want to move. You know what? The children used to take susu pekat manis, right?
Wow. Daily.
A tin of susu pekat manis. The mother will just take few spoons, add with water, and feed them. That is their milk. So you can imagine what they were eating, what they were this thing. So all worm infestations, terrible. So what I did, I admitted the entire family, because I'm the district, this thing, including the parents, the children, all five. And I nicely nourished them. I asked the dietitians here, there, and they were getting free hospital food for a week. I mean, I decide who gets admitted and discharged, so I don't care. So I kept them in the ward. I nourished them. I called the Jabatan Hal Level Orang Asli to actually come and assess this family. I called the main officer. I asked them to give them supplies. They have a peruntukan. Jabatan Hal Level Orang Asli has a separate. I mean, these indigenous people, the government has put aside money actually. So they can get supplies, milk, basic necessities, rice, whatever thing, they got money to actually give them. So I asked them to put them under the program, make sure they get their regular supplies, treated their worm infestations, and they were all well done. You can literally see them put on weight in 2 weeks period. So that was an interesting thing. I was happy that I could do something like this. And then detecting, contact tracing, calling the state engineer and all, we detected that they were taking water from a source of a old ancestral well. in the village. So I even contacted Jabatan Bakaran. Then we actually discovered that it was not the government's fault. They already built the main piping system to the main road, right? From there going into the village. So they built, but this group of indigenous people, they worship the inanimate objects and all these things, tree, whatever, sun. But then also they refused to take the clean water because they said my ancestors were drinking from this well only, so I should still drink from the well. So that well, we took the water, we sent it to the environment health, and we found all kinds of things, like basically salmonella, typhoid, basically causing all these things and also leading to all these problems.
So was it a whole community that was drinking from that
Yes,
well?
yes, yes. There was a whole community. Yeah. Mm.
So you had to deworm the whole
I had,
community.
I had to literally, yeah. So I worked together with Jabatan Halewa Orang Asli. I called the state engineer. I mean, that was an interesting period working with everybody. I mean, I must say everybody was supportive. People say, oh, the government don't do anything and all that. Actually, everything is in place to actually help these people. But sometimes whether receptive, we are quick to point out, right? Oh, how come they're not getting clean water supply and all? They have done everything, but you can only take the horse to the river or to the water source. The horse has to drink it, right? Similar to that, the Orang Asli community, they sometimes because of their ancestral beliefs, they refuse to, So we have to educate them, like we have to get the Jabatan Hal level Orang Asli to actually deal with all this.
Yeah, when I was I was working in a clinic kesehatan as well, clinic kesehatan Pertang. It
Okay,
was somewhere in the depths of Jelebu. We
right.
also had to deal with a
Yeah,
lot of the indigenous and the
yeah,
orang asli.
yeah.
It's very, very difficult. Like,
Yes, very
know that there is a child in there in the jungle who
right.
has probably a hemoglobin of 6, but
Yes.
they will refuse to come to the clinic.
Yeah.
You actually have to hike in there. You have to send the
Yeah.
nurses or someone who can speak their language to
Yes.
convince them to come out.
Agree.
So yeah, I mean, as you're talking, I remember all this difficult times we had. We even had to hike in there to deliver a baby with no lights, and it is very interesting. I mean, if for a person who likes all this adventure,
Yes. Yes.
this is actually very, very
I
exciting.
guess even in our colleagues who have gone to Sabah Sarawak, I'm sure got even more stories where they take a boat for like hours and all that. I mean, but even in Semenanjung itself, lot there is.
So after Pekan, what happened? Where did your next path lead you?
So after Pekan, then like at every stage of my life, I think like that day we were discussing, yeah, talking, right? I said I always reach one comfort zone level, whereby when I reach one comfort zone level, then I know I already need to challenge myself. I don't like to stay in my comfort zone because then I become very lackadaisical and complacent and too chill. And then because even in Pekan, I was doing that time I was single, so I used to whack locum weekend. I will go in on Friday and do locum until Monday morning and 6 o'clock and drive back to Pekan to do work to work on the day. So as when you are single and all that, you got nothing much to do. Weekend you just work lah. Everything was per hour, right? The locum rate is still 40 ringgit per hour, just like last time. Anyway,
It never changed.
it never changed. So anyway, but then I mean that time that was a lot of this thing as well. So what I would say is, I thought I need to challenge myself, and I knew I wanted to do orthopedics, so I wanted to apply for my masters. For me to apply for my masters, obviously you can't apply from the district hospital. You can apply, but you need to go back to the tertiary hospital. And so I again, my hero, I contacted Dato Sri Prem, who was my mentor. I told you, and told him, Dato, I have two options. One is request for transfer out of Pekan Pahang, that means out of state, where I want to come back to Klang Valley and try to get into orthopedics somehow, or you have to put in a word that you need MOs or anything if the department needs, so that I can come back to orthopedics in Kuantan GH and then get my master's that time. Because that time there were so many rules. They said if you have not been a medical officer in orthopedics department, you cannot apply for masters unless 2 years you're there. All these rules. I mean, all these rules were not on paper. It was just CSC. But this was how it is like. So you apply from the district or you apply as a very junior MO, they say you don't have enough experience, no cutting experience, we cannot give you masters. So that time it was like that. So two options, I told him. Then he wrote to JKN Pahang Jabatan Kesihatan Negeri, and I put in my transfer, and I managed to get into orthopedics in Kuantan. And yeah, I after that was application of masters and all that.
Okay, so I mean, medicine is like such a broad field, so many specialties to choose from. And then there's orthopedics. I remember when I was a houseman, actually, when I was still practicing, everyone called them the carpenters, right? The orthopedics, the carpenters, the orthopods. All they care about is that it's a perfect bone reduction. I remember when I was in ortho as a houseman, one of my senior housemen told me this orthopods, all they care about is the bone reduction. Patient can be unconscious right now, and they will just look at the x-ray and they'll talk about how perfect the bone reduction was.
Right.
So what made you decide to go into orthopedics?
Yeah, so I think I was very intrigued with the fact of surgery per se. Actually, I would say my first posting was surgery, actually general surgery. But my fourth posting was orthopedics. But so during the general surgery period, I hated going to OT. As many housemen didn't like to go to OT, right? You go in there, then you start and the assisting and all that. I hated it. That was first posting. So I was still in culture shock and trying to adapt. But when I went to orthopedics, I really liked the engineering mechanical part of it. Somehow or other, I was never kind of like this kind of gadgety person or fixing things, or I'm the one who fixed the things in the house. No, my late dad and my brother, they were the one doing it. But somehow or other, when it came to the human body, the bones and the soft tissues and this and that, doing all that, as a houseman itself, I already did MO call the second month. So 4 months of housemanship. Second month, they already, like Gambate throw you in and say you have to do because Hari Raya, everybody is taking leave and all that. Anyway, so I was doing K wires and fixing bones and putting plates and screws when I was a houseman. So that kind of like drove me, okay, this is what I want to do. And like I said, the mentorship of Dato Sri Prem and all that, you look up to people like that and try to, and you start dreaming, maybe my future is this, then so you get that interest in orthopedics and all that. So that's how that early days where I started operating and all housemanship, fourth posting already, when most of the other housemen are, no one is allowed to go to OT and do all the procedures. We were already, So that's how I think that was the initial thing which drove me to do orthopedics. Of course, that time I didn't think of whether I'm going to go into subspecialty, but that was just for the initial stage. Like I said, I wanted to challenge myself to go deeper into it. Yeah.
But was it easy to apply and get into the master's program?
Again,
Because
easy.
I think it's getting harder. Like
Yeah.
even right now, it's getting harder and harder to
It
even
is.
get in.
It is. It is. So at that time, we didn't have much. Like there was a set criteria, everything on paper given to you, or this entrance exam, that entrance exam you have to pass before getting in. Now everything is very structured. There is a criteria, screening criteria already, and you have to fulfill this requirement before you even apply. Last time was not so. They will say randomly, they will say you have to have some poster presentation, you have to have this much experience, 2 years. All this thing was very random. So what what happened was I kind of like applied and I got rejected as usual the first time because citing reasons that not enough experience as a medical officer. So I just pursued. I said, okay, fine. The next year I will apply. So I applied again. And interestingly, I was already in Kuantan. So I got into IIUM, International Islamic University Malaysia, which is already in Kuantan itself. So I didn't have to move. So I was there in the university and in Kuantan GH. So it was also of a convenience, and also managed to get in like the second attempt of application. A lot of people applied and didn't get. Things like if you don't have enough podium presentations, publications, poster presentations, or even logbook, if you can show how many cases you have done, all these things were the criteria then. Nowadays, there is a entrance exam ready. You have your BSSC, they have the part 1, part 2 and all that kind of thing where you pass, and then if you pass that, you get. So there's very clear criterias.
Did you have that mindset like, regardless, I must get into orthopedic? Were you
Yes,
thinking like that?
yes, definitely. Only orthopedics, yeah. I already made up my mind. I would only, yeah.
Was there any case in ortho that stuck with you? Like, as you were going through masters, was there anything that really stuck with you till today?
Orthopedics, huh? Okay. I mean, a lot, I would say. I would say, like, my first interlocking nail, probably, putting in the nail for the femur and the tibia fracture, those kind of things. Really, when the bone is all broken and haywire, and then you get it fixed, I mean, the satisfaction you get when the patient is okay, and looking at the X-ray, as you mentioned, right? When we see the X-ray, that okay, good job, bro, like kind of thing. You pat yourself in the back. That's one. And I mean, I've also been involved when I was a registrar. We had this case whereby a guy, a gangster, so called, somebody came. He was in Klang Valley somewhere, one of the restaurants. They just came. They chopped off both his hands at the wrist level. Total
Wow.
amputation at the wrist. So, and so happened at that time, Selayang Hospital Hand Center, KL, everywhere had a hand replant or revascularization going on. And this guy had nowhere to go, and they called up Kuantan GH. We had hand surgeon, hand trainees there at the time. I was a senior registrar. And so we had to go, that guy was sent to Kuantan, and we had to go in and we had to do a bilateral replantation. That we had to connect both the wrists, basically every single artery, vein, and nerve, tendon, everything. So we did it two teams, one hand trainee, one hand surgeon, one more, two senior registrars, one on right side, one on left side. So it took us 20 hours.
Wow.
Okay. And we were like a zombie when we came out. I still remember going into the pantry and the nurses brought us some Milo or breakfast, something. I sat down drinking my Milo and I just collapsed there sleeping, and the Milo was all over my scrubs. And the morning shift nurses came and woke me up and helped me clean up. And that was really crazy. That
So
what
20
considered
hours.
not to do hand and microsurgery. I would say no, but then the hand survived though. That was good.
So 20 hours. I mean, I was in OT as a NS. You know how NS we have people swapping and you can go toilet, you can eat. So as a surgeon who was scrubbed in, and it's only two teams. So did you go to the toilet to pee?
Yeah, of course we do. We take turns a bit also, because you have to go and pee and probably take a drink or freshen up a bit, because sometimes, like say when we do the artery, then after that there is a flow and all that, we let it rest for a while, we cover the thing and all. Sometimes when you do the vein, and then probably the tendons all separately, so you have these breaks. We take turns, two of us, one floor do clean up first, wash a bit, cover it up, watch. We need to observe the color, and then perfuse, warm the hand. All these things we are doing. So we do have to take breaks. Like you don't have to hold your pee for 20 hours, no.
This patient, like,
Yeah,
did you
so
see the progress?
yeah, I still remember his name was Michael something. Anyway, the hand survived. The hand survived. Both the hands survived. And yeah, I mean, I did see him during follow up. So that was very good, rewarding. But I mean, hand and microsurgery was just not for me. Lah. So we just did whatever we need to do. And I went into, what do you call it, arthroplasty. After I finished my orthopedics, I decided to do joint replacement. Seeing the rewarding feeling, rewarding for the surgeon and the patient, especially hip replacement and knee replacement. Yeah.
Okay, so before we go down the subspecialty part, what was it like the whole master's program for you? Because remember when we had this conversation, I told you I had colleagues who went into the surgical master's program. I mean, I saw them before they were my senior MOs, but as I was NSMO, he was a surgical MO and he just got into surgical masters. I saw him before that. He was this fun, jovial person. Actually, three of them, right? And then slowly I saw them change within a year. All the black hair turned gray. Some just lost all his hair and he was no longer this happy, jovial person until he dropped out and he became a happy person again. So what was it like for you?
I totally agree with you. I myself had three of my classmates drop out. So I know how it feels. I know what they go through. Yeah, like I said, it's a stressful period. Different people go through different feelings. I think certain environments are very, very toxic, I would say. I'm not ashamed to say that in many of the departments and all that. I don't know why some people just have this toxic attitude, but then they say that it is to actually toughen you up and make you somebody who can deal with a lot of stress and all that. But I guess there's different ways. People have different personalities, so you can't just. So for me, I'm thankful that I had very good understanding professors and lecturers. I would say in UIA, in IIUM, the guys who were there were some guys who were really, there are fellows who have shouted at me and all that, done this, but not to that extent where, I want to give up straight away. I mean, they were very understanding. The day I had to go for my master's interview, my dad passed away.
Dear.
February 11th to 2010, supposed to go for interview, but then you join the master's in May or June, or around there. January was the interview. That day the next day I supposed to go, and the 11th, 12th was the interview, 11th my dad passed away. And these guys, you know what they did? This bunch of professors from UIA, I would never forget it. They actually they had the interview on the 12th. They purposely officially had a second interview, called a few more candidates as well, just to say, go and settle your dad's thing, take 1 or 2 weeks. After 2 weeks, we have another interview. And then they gave me the spot the second week when I came for the second interview. Because the first interview I couldn't go. My dad passed away. So I would forever, ever, I'm indebted for that kind of understanding these people have. I'm telling you, okay? They're everywhere also got people who shout, they don't know how to deal with juniors and all that. That is why, but in a way, I would say, that's why I decided I will never become like that. In a way, looking at all this. But I think the stress can get to you, the toxic environment. People should be encouraging when you are, go through. And then it is sometimes normal to make certain mistakes while you are in training. That is why you're under supervision and all that. Not allowing mistakes to happen until it costs a patient their life or something life endangering. That's why you're under supervision. But sometimes the supervision and all that is disrupting the senior guys' normal schedule and all these things, right? So that becomes, all this anger and all that. People need to know how to manage anger and all that. But for me, I would say not too bad. I could manage. It's just a little bit of here and there stresses. You have to juggle work and exams and all this, But I guess sometimes you have to know where you want to draw the line. Okay, what is the worst you can do to me? You can scream at me. You can shout at me. You cannot hit me, correct? You cannot do something to destroy my career, maybe, So I would just persist and move on and bulldoze my way through, and I will prove it to you, that. So there's this one guy who told me, you will never ever make it. You can never pass the exam if you answer like this. What kind of things and all that gave me. But I, instead of taking that as a negative thing and giving up, I did what? I said, let me prove to this guy the next exam. So I proved it. So I performed so well in that particular one, the following exam, that guy himself commented and said, the essay answers which this guy wrote, I have to even go back to the books to actually see what exactly is written, to even revise myself. So this kind of positive things can reinforce you. Take it as a challenge. When there's negative things coming your way, take it as a challenge, bulldoze your way through, chase your dream. That's my advice.
Some of the toxicities that you have observed during training.
I mean, of course, people using foul language and scolding juniors, subordinates, or even reprimanding and scolding subordinates in front of patients. All that I also cannot stand, because for me, even how angry I am or whatever to a junior, I would say I'll take them aside separately and tell them what is the lesson need to be learned in this, but I will be firm. But belittling a doctor in front of patient and all that is not acceptable, because what does it do to that person's self-esteem, So those kind of things, and then yeah, being a bit more understanding and trying to inspire and encourage rather than belittling, and also things like personal body shaming remarks, or very very bad foul language, those kind of things lah. And then yeah, that's not nice lah. I've seen all this. Yeah, so not to mention any names and all that. Not,
Do you think it's a systemic issue?
I think it's not throughout globally everywhere, but there are isolated cases, and in some specialties, I think it's quite rampant. Yes.
As I was I was an NSMO in Seremban GH for quite a while. I remember seeing a surgical registrar screaming at the houseman at the top of her lungs. She was saying, "Are you stupid or what?" And the reason for that scream was because he called her twice to tell her patient is on table.
So that is totally, yeah. I think some people are just lost it lah. They probably have some other stress going on. Take it out on the junior houseman or something lah. I don't condone that totally.
Yeah, I felt so.
These kind of things, I think even as a junior, you should probably speak up. Yeah, I mean, not just take it. I'm not saying take everything which comes along your stride. Some injustice and some extreme ones which is uncalled for, you should actually call it out. I mean, stick up for yourself and say, I mean, just to call you because the patient is under, it is totally unnecessary for you to use this kind of language on me. That's all. I mean, as a person, everybody is a human being. You have your own dignity and rights. You should speak up. Yeah, I mean, you don't have to be worried you're going to be victimizing me or whatever. Yeah.
Yeah, it was a very terrible session because I told her that I was the one who told your houseman to call you, but she refused to acknowledge and she continued screaming at him. And you know how houseman, when you get into OT, you have to dilute
Right.
antibiotics.
Yeah.
His hand was shaking so uncontrollably, and I had to tell him, "It's okay, I'll handle this for you. Why don't you just go get ready?" And I forgot about that incident. Like, I just forgot about it. And a couple of months later, he was a houseman in NS.
Right.
And he told me I forgot about him.
Right,
And he
right.
just told me, "You were the nicest person to me. You actually stood up for me." And I thought, wow, I can't believe you actually remember that because
Yeah.
I completely forgot about the
Right.
incident.
Right. Yeah, I mean, that has happened a lot. I guess.
So I think we don't think about what our actions does, because as you climb up the ladder from a houseman to an MO to a specialist, you have more and more power, and with all
Yes.
that power, there's actually a lot more responsibility.
Right. The impact which you have we created goes a long way. I mean, I've seen that a lot now. Yeah, I've seen.
So what do you think helped you succeed? What do you think was the secret sauce for you, or your secret ingredient, or things that helped you power through and complete your master's program?
Yeah, I think a lot of perseverance and resilience. Of course, I give credit to God's blessings and my supportive family. Yeah, I mean, many people say once you get married, your spouse will always will that is their additional stress lah. But I'm thankful that I had a very understanding family, my wife and kids. And I mean, they never really pressured me from the other aspect of, how come you're not home? How come you every time have to study? How come you every time got exam? Why you have to do this? Why you have to go here, go there? You're hardly at home. I mean, I never got this kind of additional stresses. So that helped me. Number two, of course, God's blessings. I was in the right place at the right time with the right people. These are all important. And but the second thing mainly I would think is my perseverance and grit and resilience. That means I don't take failure as something to give up, because I believe fail, right, is a first attempt in learning. FAI. So fail is FAIL is the first attempt in learning, I think. Okay, and I believe in another saying: a setback is a setup for a comeback. So always think that if you have a setback, think of it like it's something to actually drive you or push you to actually make a major comeback. Don't look at it as a setback and then that's it, gone, everything is gone. Maybe it's a setup by God to actually say that this is actually a setback now to actually humble yourself and get back into the drawing board and see where you're supposed and what you're supposed to do. So don't look at the failure as something gone. That's it. It's the end of my life. No, that failure probably tell you, look here, probably maybe I would experience it. Meaning, maybe I thought I was too good already. Maybe I thought I already know my subject in and out. I would never fail. But suddenly they tell you, you know what? Come back in 6 months. Then what do? Are you going to let the worst thing to get to you or what? Or you look back and say, actually, maybe my knowledge is not so adequate. Let me just whack it this next 6 months and prove them wrong. Look at it that way. So then after that, your knowledge also gets better, your experience gets better, and then you are going better prepared for the battlefield with all the bullets in hand. So rather than looking at it as a setback, then after that, when you go for it and then you come out victoriously, it's a 6 month setback. But at that time, you are in the right place at the right time. You understand? So then you look at it as after that, it's a comeback already. It's not a setback already. So I think it's our perception at the end of the day. Perception. So supportive people around you, supportive friends, supportive family. Believe in God definitely, and you have to have other things also, not just drown in your work and studies. You should have certain avenues which sports, hobbies, whatever, those kind of things. Or maybe you like to go to the movies or meet up friends and have a good time on a weekend, maybe some nice dinner, a few drinks, whatever. Those kind of things, I guess, is important to it's like a refueling, rejuvenation, whenever you can. Yeah, that's
What
important.
was your avenue?
What was my avenue? Like I said, I have good set of friends. I would go traveling a bit maybe, and sometimes I just go for a run or something and just clear my mind. It rejuvenates me, those kind of things lah. And then probably just some meetup. We have this bunch of my medical school guys. We call ourselves the Charaka boys because the Charaka boys were the one we were used to stay in the hostel called the Charaka hostel in Manipal. So we once in a while we'll plan our get-togethers, reunions, and we go for holidays all together. So these kind of things all kind of fuel you. So I had these kind of avenues. Of course, church on the weekends, Sundays, those kind of things. Family time as well. Dinners, outings, holidays. These kind of things, kind of like something to look forward to get you out of the stress. Yeah. So those kind of things.
So, what made you decide to subspecialize?
Again, back to I told you comfort zone lah. When I finished my masters, I was in Sabah, Kota Kinabalu, right? So I had a good working life and experience in Kota Kinabalu, I would say, 2017 to 2019. Yeah, it was a wonderful experience. I loved Kota Kinabalu, loved Sabah. Working there, the people are nice, awesome time, working colleagues and all that. We had a good team. I was in the joint replacement team as well. So, but again, I reached my comfort zone. I was doing everything already, and I reached a stage whereby, what more? Like, I wanted to delve into the inner depths or the details of the knowledge in terms of hip and knee replacement and arthroplasty, basically. So I said, if I was going to do this, I better do it properly and know the ins and outs and so the avenue was either I can just go for fellowship somewhere, or I have to do the subspecialty program, which is a 3-year program, and where you get to go overseas 1 year as well. And it's a 3-year properly structured program with exams and papers and this and that and a lot of learning and here and there and then operating and all that. So that's why I decided, okay, you know what? Let me just apply and see. But I applied, like I mentioned to you, very reluctantly, just saying that even if I don't get it, it's fine. I love Sabah, right? But then I got it. So I had to come back to Kuantan after that when I joined the subspecialty program in 2017, basically. And under my initial mentor again, my trainer was Dato Sri Prem Chandran, my first trainer. Yeah. Yeah.
Okay, so what happened next? You mentioned you went to Australia and did a fellowship program.
Yes. Yeah.
What was that experience like?
That was one of the best experiences. I went there with my family as well. I got a paid job there. So that was good. It was a 1 year fellowship under the tutelage of Professor Dr. Ross Crawford, who is one of the legends in hip and knee replacement in Brisbane and worldwide known as well. So I did a fellowship of a 1 year fellowship there, and which includes robotic surgery as well. So that was really an interesting thing. Robotic surgery was new at the time, especially to our region and all that. And I would say it was one of the best times of my life. Although stressful, I felt like I was working like a houseman again, like in the initial stage, because you have gone to a foreign land, you are operating on their people, and everybody's watching you. I mean, how are you performing? How's your mannerisms? How are you dealing with patient? How is your operative skills? I mean, so the first few months first, I would say 1 or 2 months was very stressful because everybody's watching you. And then once they're accepting of you, or the acceptance is already there, things are very smooth sailing. They already trust you and everything is very smooth. And now your trainer also trusts you. He just leaves you to do the cases while he goes on holiday. I mean, these are the things which really built up my confidence and all that lah. So yeah, that was a very interesting period, learning about the robotics and all that, and equipping myself. Yeah.
Was there any differences in culture? I mean, from Malaysia, because you went to Australia. So, what was the culture difference like?
So you see, one is generally speaking, as Malaysians or Asians, we never ask questions much. You always, the boss is always right, right? But my trainer there, he doesn't like it if you don't ask questions. You have to ask questions, and not only ask questions, you have to challenge him. If he's doing a particular thing, you have to challenge him. Why are you doing it this way? Why can't you do it this way? This paper says that paper's research says that. Why are you doing this? What are your reasons? He wants that. He doesn't want you to just sit back and say everything is yeah, yeah. Yes, boss thing is an Asian thing.
Come on, Dr. Jeffrey, can you imagine a houseman during rounds challenging your consultant? Why did you do this?
Challenging, like I encourage that. In fact, I mean,
to ask questions, because as housemen, right? I remember as housemen when I was still in housemanship, they said please to stay under the radar.
Yeah.
Don't ask too many questions, or they're gonna start marking you.
What we'll do is in our team, like when I was in HKL and all that with Mr. Gunalan and all that in the arthroplasty team, we encourage asking questions and also teaching. So we'll tell the houseman when they come in, we'll ask them to introduce themselves and all that. After that, we tell them, please ask whatever, even if it's a stupid question, we are willing to answer. And we encourage them to talk and learn, and we also ask them questions. Why? So that it's like a mutual thing. Even if it's a stupid question, I'll tell them it's okay to ask in the initial period. Not at the end of your posting, then you ask stupid question. That means you didn't learn anything. We have failed as a consultant. So I think that's important. It all depends on the culture and how we this thing. But I agree with you. Not everyone would do that. Yeah. So that was the culture different. And another thing which I like in Australia, everybody you pass by will say hi or hello, hi bro, or there they say mate, right? So hi mate, how you doing? Like how it's going or how you're going. They say how you're going. So everybody is with a coffee in the morning, how you're going, and when you come back on a Monday, you better be ready with a story like what you did for the weekend. Not like us Asian sitting down and then nobody asks you how your weekend is, right? Every week, because Monday is an operating day there. When I'm scrubbing, either the nurse or my trainer or the scrub nurse or the other junior doctors or whoever will ask while you're scrubbing, how was your weekend? Everyone would have done something over the weekend and they want to know how's your weekend. So on Monday, you better be ready with a story what you did over the week. You went for drive here or there, or you went for a party or something like that. So everybody is very animated and very expressive talk. They ask questions readily, they get the answers. It's like the interactive part, that confidence is very important. You learn something different about the culture. Yeah.
So, do you think there's any chance that that is something we could implement here? And if yes, so how can we start?
I think the mindset need to change. The mindset need to change, but it has to come from the top. It has to come from the right. I actually, like you say, I would say in some hospitals, some teams, we are already doing that. I think when I was in the government itself, wherever I worked, especially, I think we try to emulate that culture, like as in we can treat each other like human beings, whether they are junior or what, not to victimize them or this thing. Yes, we can firmly correct them because we don't want mistakes which cost patients' lives, but there are ways to do it. So that culture need to come from the top, from the consultants, specialists, whatsoever, and then create that culture where they are also comfortable in uh learning together and asking and this thing. And then of course another thing is you should have team buildings and all that. So outside work we should suddenly go for dinner somewhere, go on party somewhere or something, get everybody loosen up. Not just that hierarchy, I'm the boss, you are the down there, no. This one all goes a long way. Forever and ever they will remember these guys, they were nice to me. Like how you said your incident, similar to that. They will remember for life. And that will be an impact. And then they will go on and do that with juniors. So that's how you pay it forward, right? You change the culture. So eventually the culture can change. But I can tell you, with certain people's mindset, certain things just can't change, like in certain places, if you know what I mean here.
If, say, a specialist is listening to this podcast right now, like what would you tell them, like the first thing they can do to just implement this difference in culture that you saw was so effective in Australia? Like what's the step 1, 2, 3 that they can implement in their department?
I think, yeah, okay, implement a culture of the teamwork thing. Teamwork thing. Make them feel important. You see, that's one thing which we do as a team. Sometimes we tell the houseman, I always tell the houseman, look here, it's very important. No, what you're doing, you're calling the patient or something. You make them feel important, make them feel needed, encourage them, and inspire. The meaning, teach them at the same time. If they make a mistake and all that, tell them firmly, but and also explain to them why. Of course, it takes a lot of time, but I think it's important because then it creates that culture. So I believe that teamwork, that encouraging of asking and then teaching, that is very, very important. But at the same time, maintaining the decorum and discipline. If I'm coming to work at 7 o'clock, you don't walk in at 7:30. That should be the way. So even though you see, some people feel the sense of, especially some of the housemen maybe coming from very well-to-do family, drivers driving them here, there, everything. They go according to their time, whatever. But when you come to my department, there is a certain sense of discipline. I come towards 6:30 means obviously you should come 6:30. If I come at 7, you come at 7. You cannot walk in at 8 and say my working time starts at 8. See, this is all not acceptable. Correct. So if your husband say, no, 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 when I signed up for this, my working hours supposed to start at 8. So do you come at 8? No. So this kind of flexibility and all need to be there. So establish the ground rules in the beginning. But at the same time, when something bad happens or a mistake or what, reprimand very professionally and tell them what is the lesson there. And then work as a team. At work, I'm like this. But doesn't mean I've already scolded you, I cannot be your friend. Outside work, I can still be your friend. We can still go for dinner together. If I see you outside, I'm not going to say, oh, this fellow did this and forever hold a grudge. Work is work. Outside is outside. That's it. That's what I believe. That's my style. Yeah.
Think that's very powerful what you just said, making them feel important. Because if I'm remembering housemanship, I felt like a bottom at the food of the
Yeah.
food chain.
Yeah.
Nobody wanted me, nobody needed me. I just need to keep my head down and finish my work. But I did work when I was working in Sungai Buloh. This one I was a medical officer already in the ICU team, and my consultant, she graduated. I mean, she did her residency in Australia. She came here and then she set things up, and the culture she brought in was so different. We moved as a team.
Yeah.
She waited till the team was complete, and then we start seeing patients.
That's what we did. Yeah. Yeah. So as a team, everybody has a role. So they all follow their roles and everybody is as important, So anything we look for a houseman, they are running around doing this thing and all that, and we appreciate it. At the same time, example I'll give you, if they we ask them to get ultrasound scan, CT scan, all that, they have to go and see the radiologist, explain, sometimes get shouted at and all that. That's another thing. As a boss, I feel if I was a consultant, even I've done that numerous times. stand up for your subordinates. Stand up for your juniors. If they come and tell me the radiologist shouted at me for asking the CT, they said, cannot give appointment. Come, let me come with you. Go there and ask them, why did you shout at my radiologist? Now I'm a consultant asking, right? You cannot shout at me already, right? So I'll ask them, it is wrong for you to shout at my houseman, because stand up for them in front of them. Let them feel that importance. I think that is very important. When you stand up for them, things change, things shift. Yeah.
Was that something you did for your houseman when you were a
Done it
consultant?
numerous times. I've done it numerous times. I've called them. I've this thing, sometimes posting case under emergency, even NS or what. So I'll just call them. I said, and then after that, they changed their tone and said, no, the houseman didn't inform me this. No, la. I said, they are houseman, la. That's why I'm calling you now to explain to you what is the context of the whole thing. Maybe you didn't get the whole picture, but I would appreciate it if you don't scream at them, la. They are doing work for me. So I will tell nicely, la, not like a fist fight. So sometimes you have to stand up for them. And then when they see that, things change. The floor will eagerly come and do work for you. You come at 7 o'clock, the floor is there, 6:30. No need to tell. Why do you have to force these things to people? So the floor is happy. He is needed in the team. My boss will stick up for me, even if anything. Come la boss, no man, I will take this appointment. No, those kind of things, So this is how we work. And these guys, some of my housemen from my medical officer, they still keep in touch with me. They still contact me when their parents have knee pain, hip pain, and come for appointment and get replacements done. This is like years ago, 10 years ago, 15 years ago, my houseman all still keep in touch with me. Why? They remember. So I think you have to make an impact that way.
Can you share a story of one houseman's life that you think you've changed?
Changed. Okay, maybe particular, it changed.
I mean, that you can think of that you've probably said something to him and it has
Yeah.
created an impact.
Okay, yeah, I had this guy who came to sign his logbook. Actually, he had never worked under my team. And he, in HKL, when I was back in HKL, it's a huge place. So many housemen, one particular specialist cannot take care of. So they're divided. They have to come and see the consultants for their signature of the logbook. So they have to complete the logbook. We sometimes ask them a few questions and, we sign their logbook, look at it. So this guy came up to me, boss, I need your signature for logbook. The admin said I have to see you. I said, okay. So who are you? Tell me about yourself. I've never worked with you. Have you been on call with me at least in the houseman? In emergencies, sometimes I'm on call. They'll have different housemen, right? Have you? Yeah. Once I've done rounds with you. Okay. So I didn't notice you. Okay, fine. So I said, maybe I'll just ask you 3 or 4 questions about orthopedic emergencies, because all you need to know is these few things. Emergencies, especially when you leave orthopedics, because maybe you're never going to do orthopedics. This is the end of your posting, It's not about signing your logbook, but something about your knowledge, okay? So I asked him, and then he was struggling a bit to answer. So I told him, okay, you know what? I believe in second chances, so I'll give you an opportunity to go and read these particular things. I told him what to read. So shock, pelvic injuries, some fracture dislocations, all these things. Just read what you're going to do emergency when they call you in the ED, or you go to a district, they call you. So he went and read. He came back after the next day and all that. So he could answer everything. I asked him and all that. So I asked him, remember that for you to get the signature of the logbook is a small thing. I can just sign, you can pass, you move on with your life. I know you are very stressed out when you want to get the logbook signed, because you don't know what kind of personality this guy, whether he's going to shout at me, don't know how to answer. He might not sign because I didn't answer, and then I get extended in the posting and all that. I say it's not about that. It's about, are you equipped and being a safe doctor or not? Because I told him, just imagine this. Now you filled up your logbook for the sake of filling up and all that. You say some resuscitation shock. But when I ask you a question, maybe you initially couldn't answer. Now you read, you know. When you have a case, you know what to do. Now, I am asking you and put you in a scenario whereby you are back for holidays in a Hari Raya time or what. You're sitting down. You're standing there, your kampong, everybody having some nice Hari Raya, your uncle, auntie. You are the only doctor there. Suddenly your uncle beside you collapses. What do? If you are not equipped enough and you don't even know what to do, or CPR or whatsoever, how you're going to stabilize or resuscitate, if you don't know and you're not equipped with the knowledge and you are the only doctor there, everybody's going to look up to you and say, please save this guy, right? At that time, what do? It's not about your logbook or passing the exams and all that. It's about being that doctor who knows what he's doing, right? Maybe you're in a flight and then they ask you, somebody collapse, any doctors on board? You are the main fellow there who could possibly save his life. So imagine when you're in the situation and look at every particular end of posting or exam or logbook as that this is equipping me to be a better doctor, to be knowledgeable. So I need to have this knowledge minimum for me to move on. Then you look at things differently. Don't look at it as a burden. Don't look at the logbook or the signing as a burden, because this is to actually improve yourself to be a safe doctor, even to your family or immediate. So these are the things. So I think when I said that, his face changed. He looked at me like, this has changed the entire. So I think I have, to a certain extent, changed his mindset. He's better. He said, nobody ever told me this. I never saw it that way. I always looked at it as a burden. Yeah, finish posting me, must go and meet this difficult specialist and consultant. They'll be so garang. They're going to scold me. I don't know anything. My knowledge is poor. No, so equip yourself. Every case you see during the posting, try to think, what are my learning points? What am I going to take back from this in future to be a better doctor? What happens if this practical, make it practical? Then it doesn't become a burden. It just becomes a routine thing. You will just ace through it. And later in life, 20 years from now, you will remember what I'm saying, how it has impacted. I told him. So for me to say whether I changed his life or not, I don't know. But I told him, you will definitely never forget me for the rest of your life for telling you this. And I'm sure I did see him after a couple of months. He always acknowledges me. And HK is a huge place. You may be in other district also, but if you see each other outside, very rarely you can actually bump into some old houseman. So, but yeah, I would think that I would made an impact. I mean, I've had a few housemen who are now medical officers and all that, who have opened their own practice and who have been victimized by other specialists, and until now they hold the grudge. I mean, they will say things like, if I see the guy on the road, I probably run him down. I mean, example. So, but these were all where I stood up for them. I covered them and tried to get them away from the toxic environment, and eventually this thing. So these are the guys who until now they keep in touch with me. And sometimes I always tell people, you cross paths with many people, you do not know when you would actually need their favor. Don't think of the guy or junior guy, a houseman who is actually useless, who you will never need their favor. Tomorrow, when you need a favor from your fellow human being, it all depends how you actually treated the guy. Because I'll give you an example. That particular guy, when he was a medical officer, I had a friend he opened a clinic in Jalan Klang Lama somewhere. You imagine the chances of that happening. I had a friend who was vomiting diarrhea, couldn't even come out to go to the clinic and had no one to this thing. And so happened this guy's clinic is down the condo. And he actually went to the house and treated her. Because they were desperately messaging me, do you know any doctors nearby or not? I only know this guy. This guy was my former houseman. I only know this guy has a clinic in Old Klang Road. So I asked him, are you nearby? Boss, this condo is next to my clinic. I'll go now. When put drip and this thing. So you got connections everywhere. So because you have been nice to somebody, one day you need some favor, the fellow actually helps you. Better be like that than being toxic and making enemies all around you. Correct, no? So be positive. La.
Wow, that is such a powerful story that you paid it forward basically.
Yeah. So
Because you like you say, you never know whose help you will need down the line. And it sounds like for somebody to just succeed, housemanship or MOship is really the team and the
support.
bosses, your superior, someone who believes and trusts in you. Because I'm thinking back when I was MO in my last hospital, I enjoyed housemanship. I wanted to become an intensivist. I'm now thinking back, the last place I was at, I really didn't want to go to work. I hated work so much. I dragged my feet going to. I just didn't like the
Yeah.
feeling there, the environment. I felt like everyone was against me because I was injured.
Mm. Yeah, sometimes, yeah, that's it. So I guess if you are someone in that position, I know, I mean, everybody goes through different circumstances. For you, I mean, of course, now you look back, you think that way, but it's the journey and the path which probably God had different plans for you, or the journey or the path which you have to take is sometimes like that. It actually teaches you. You see, if you didn't go through that, you wouldn't have founded disruptive doctors, right? Correct. I mean, if
That's true.
yeah, so the journey of life for different people is different paths. Sometimes to go through certain hardship to see the light at the end of the tunnel, or to actually see your calling. What actually your calling is. Maybe you only thought in your mind that you're supposed to be an intensivist, but your calling was actually to actually help out all these other doctors who are this thing, and so many people are coming to you. So this is just different things. Sometimes we don't know what is our calling. Yes, we can have a dream, we can have aspirations, but that's what I always believe. Even signing a logbook, or even when I take students for exam, I've gone for professional MBBS exams, juniors, students. I always think, now my action, which I do something to this guy, whether I'm giving the marks, or I'm evaluating, or I'm talking to him, or I'm teaching him something, whether I'm going to ruin his future or build his future. I always think that way. I might ruin his future by belittling him, or maybe really discouraging him and failing him in that time. Then he might totally change his thing. He might be so discouraged that he will never attempt anything in his life. Either that, or whether I'm going to inspire and change. You know, yeah, as you know now, I'm in Sunway, right? So my founder, Tansri Jeffrey Chia, he has one very good saying which I always follow, and he said, "I aspire to inspire before I expire." That's
Very powerful.
yeah. So I mean, you probably can add the word perspire while you're doing that. Anyway, so aspire to inspire before I expire. So I think that is at the end of the day, whatever you achieve, whatever, you have to inspire people around you rather than putting down people, always being negative. Look at the positive side of things, I think. Yeah.
Okay, so after you finished your fellowship in Australia, was it difficult to get a teaching a paid position in Australia?
Very difficult. So at that time when we were doing subspecialty and all, there was no one to guide you, know where to apply, where to get. They don't come and give you on a silver platter. These are the places you apply. These are the places you can possibly get. You have to put in your own effort. So you talk to friends and superiors, and you find out here, there. You go for conferences, you meet these guys who are trainers. Then you talk to them. Are you looking for anyone, or will you be able to, accept me as a fellowship? Then you email so many places, and some guy will reply you, okay, So I mean, I had to go through that journey. I had to go to somebody senior who was actually trained there, and go under him for him to give me a recommendation to go this guy in this thing. So I had to, while I was having my family and all that everything, I had to just go to another state, stay alone by myself, rent some room for 2 months, and just go, so that that guy could see my skill and see how good I can operate, to write a recommendation letter to this guy. And then after 2 years, I get a position there. So and then, yeah, so all this is the early planning, and then the paperwork. I have to get almost 50 over pages of documentation signed by not commissioner of votes. What is the other one? The If you have overseas this thing one.
I think now they have Epic, I think.
Yeah, no, Epic also. Despite that, you need to get your this thing certified
I
by.
see.
So if you have, if it's locally, it's all commissioner of votes, right? There's another one. What is that? Commissioner of votes or something else lah. There's another position where they have to certify. That one, the documents is this thick. So all the paperwork also took a long time. Of course, I have to spend a lot of my savings also to go there before you actually, get in. There's a lot of hard work which you have to put in lah, basically. And then once you go there, another round of hard work, because you have to really prove yourself. And once you are already a boss here, you're a consultant here, ordering people around, suddenly you go there as a coolie. Literally as a coolie. When you are a fellow, you're literally like just like a registrar resident, until they trust you. They trust you for you to gain that trust, that initial period, you really work hard. You really need to prove yourself. So, yeah, that was a molding period, I would say, for me. It also humbled me a lot. Suddenly, one day, everybody is boss, boss, boss. You suddenly there, you go there, you're like, So,
After that, you came back and you sat for your subspecialty
yeah.
exam.
So, subspecialty exam was another thing. Yeah. That was another stressful period. There have been days where I've even cried. Yeah. Grown men cry to anyway. But yeah, they when I went for my exam, I mean, COVID also affected me, so I was delayed because of COVID and all that. Things were delayed, so the usual 3 years took longer. Then when I finally went for my exams, and then that paper needs to be public. What do you call it? Publication need to be done. Your thesis thing and all that. All this doing while working is not easy, lah. Huh? It's a lot of work, but a lot of people help and all that. And then finally got it published, set for the exam. And then there was a setback again. They said, oh, maybe this guy is not ready. He needs to come back 6 months later. So all this thing actually impacted me a lot. It affected me. I almost would say I gave up, almost wanted to give up. But then I thought to myself, no, I've come this far. I have a dream. I'm going to get it by hook or by crook. I have to achieve this. So then 6 months later, I went, I aced it. Everything was good. I had a foreign external examiner also commented very good comments. That was very encouraging towards me. And I knew what was my standing. So after that was really good. And I would say everything, the timing was perfect lah, because it was 6 months later. After that, I came to HCare and got different opportunities, and I was there. So total of 19 years I served the government actually before I actually ventured out to private practice.
So when you sat for your subspecialty the first time, they failed you. I mean, it's somewhat like a public secret as lack of regulation in the subspecialty space.
Say you see, okay, in UK and all that, when the examiners go for FRCS exam, there's a separate this thing where FRCS examiners need to be trained to be examiners. You understand? No? In Malaysia, there's no such thing. It's probably a bit controversial, but of course, it's based on experience and what people have done, their achievements and all that. They are chosen by certain committee, powerful people to be examiners. But in all fairness, I wouldn't say the exam would be super fair. Lah. You could feel there may be some amount of not so much of fairness in it, because the way they ask the questions, you can see the way they line the questions to actually go at what direction, sometimes, So sometimes I've heard of numerous, I mean, not in my case, but I've heard of friends who have gone for master's exams and all that, and being, they just give reasons like, I don't like this guy's body language. He's just showing the negative signals, or don't like the body language. So it's not about his answers or how he's performing or what. So I don't know. All this, of course, this is hearsay, but it happens. Lah. So examiners don't need to know how to be a fair examiner, I guess. For that, you need certain training. Not everybody can be an examiner. And you need certain criteria, guidelines to say, okay, this particular person can, So I think there's a lot of gray area. But as you are, when you go for the exam, of course you have to just accept whatever it is. Like, there's no avenue. As I said, Asian culture, we are not the culture whereby I'm going to bring a lawyer and say what are the criteria you fail me with, and then I fight you in court. I probably win it, but whether you're going to do it not, because why we will think that, oh, I'll be victimized forever and ever, I'll never get my subspecialty set. Better I just bite the bullet and wait for 6 months. I mean, this can happen. Example, So yeah, if you say whether the exam was fair or not, that is my opinion lah. That maybe it was not entirely fair. The questions, I mean, when you talk about subspecialty in hip and knee replacement, you are going to ask detailed questions about the knee and hip replacement, correct? But would you be asking arthroplasty surgeon very, very detailed questions on, say, the example, the anesthesia aspect of it? You would rely more on your anesthetic colleague to do those things. So, but when you go into the nitty gritty details of anesthesia, in a subspecialty exam where the viva is supposed to be, say, half an hour to 1 hour. I mean, I think that is not fair. Lah. I mean, of course, the general thing everybody needs to know, but not the nitty gritty details of anesthesia for a subspecialty exam. For example, I'm giving you, so because the exam would say just anything under the sun can be asked, right? So where do you draw the line? Yeah.
Do you think it will change in the near future?
I guess eventually they should change to go with the time, but it's also again mindset of people in authority to do the right thing and to streamline everything so it's fair. You have to prove on paper that it's fair. How? Even examiners are going for proper training how to be a good examiner or a fair examiner, and very structured things whereby, okay, this is what you're expected to know for a subspecialty. How safe are you? Even monitoring your surgery or whatever thing, or this level of knowledge you need to. It's already told to the candidate that you need to know this before you think, right? So if you cannot answer this, but not going into some deviation details just for the intention to fail you, right? So fairness, lah. I think that is important. Yeah.
Before we dive back into this incredible conversation, there are a couple of exciting opportunities with disruptive doctors that I want to share with you guys. First, if you're a doctor who's thinking about moving into a non-clinical career but don't know where to start, or even if you're a doctor who's on the fence thinking if you should leave medicine or stay, the non-clinical career pathfinder by disruptive doctors is designed specifically for you. The problem why we doctors think that there's no opportunities for us out there is because we've been trained in sick care all our lives, but that's not true. Healthcare is a huge ocean. What you learn in this workshop is discovering yourself, where to find all the opportunities within healthcare, your game plan, and insights from me and Vivek on how to do it. And the best part is it comes with a 14-day guarantee. By the end of this workshop, you gain so much clarity on what you need to do, or if staying in medicine or leaving for non-clinical practice is for you. Our proven framework has helped more than 1,000 doctors on finding a fulfilling career. So stop wasting your time trying to figure it out all on your own in the dark. So sign up for our next workshop on our website. Next, mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening this 20th and 21st of September. This conference isn't about fitting into label, it's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025. And finally, if you haven't already, please download the Disruptive Doctors app. It is a global hub where you can connect, collaborate, share experiences with doctors across the globe, and you don't have to be limited by geography. This is more than an app, it's a movement. So be part of the community of doctors who are impacting healthcare differently. And also, can you do me a huge favor? If you have not subscribed to the channel yet, please be sure to subscribe, because it's subscribers like you that help us bring better guests for you. So whether it's the workshop, the conference, the app, or just subscribing to the channel, be sure to do it now. Now, let's get back to the conversation. So after you completed your subspecialty, you still chose to stay on in the public service for another 2 years as a consultant, even though private hospitals have been poaching you. So what actually kept you there, and what was that? Why did you make that decision to stay on?
Yeah. So I decided that I will do my dues and serve the government as well. That is one. And also, I was in Hospital Kuala Lumpur, one of the biggest hospitals, which get huge number of referrals from all over the country. So I wanted to also get myself into all the complex cases and gain my experience before just straight away jumping out into the private. So basically get my hands dirty into all the complex cases and doing revision knees and hips and all that, and seeing a variety of cases, which obviously the load is much, much higher in a big center like HKL, seeing a variety and gaining my experience before I actually venture out. I wanted to equip myself basically with all the complex things, whereby after that period of time, when you go to the private already, nothing can actually surprise you anymore. You have seen it all, So I wanted that, not just, and also, you see, I just finished my subspecialty. Yeah, I wanted to serve, because to a certain extent, the government has already helped me for my subspecialty, not just finish and take my cert and run away, Basically, yeah. So I wanted to do my dues. And one of the reasons I left also was because of the training which I had was robotic, right? So I didn't want to let my training go to waste. So at that time, the robot which I was trained in was not in hospital Kuala Lumpur as well, or in any government sector. So I didn't have the ability to actually make use of what I was trained in. So when Sunway offered me the position, I jumped to the opportunity, because I get to do what I was trained for. And that's the reason why it took so many sacrifices to go overseas, Brisbane and all that, with the family sacrifices. So you want to make use of your training, right? So that was one of the driving factors.
You know how, like at the beginning of the podcast, I mentioned there is this sort of unspoken rule that if you want to serve, you should stay in the government. But the moment you leave, you go to the private, it's all about money. And of course, I'm not sure now, maybe perception has changed somewhat, but you always get that silent judgment from your peers who are still serving, that you're all about money now. How did you deal with this?
You see, I think, okay, number one, when you reach a certain stage in life, you actually don't give a what people say. Okay, that's one. Number two, I would say, like, basically making people understand. Like I told you, my first criteria was the robot. Because I was trained in the robot, I need to go to a private center where like I told you, there was a few private centers that approached me way before Sunway, and they all did not have the robot. I went and met the CEOs, MDs, and all that. I told them I will only come if the robot is already here, not that you're planning to buy it in 1 year or 2 years. No, no, because that was my criteria. So if I was going for money, I would have jumped at the first opportunity which came. I mean, my criteria was that. Number two, the career path in the government this thing was so halted and slow that after you have studied for so long and achieved such a high this thing subspecialty and all that, sacrifice so much, and for you to grow financially or even by position, the situation is so slow. Somebody my senior for 5 years haven't got the promotion which is due to get. So how long am I supposed to wait? So for thinking of all that, that is the secondary characteristics after the basically the criteria which I used to go. I mean, the robot was number one. Number two, of course, without a doubt, it is financial part lah. Because if you're going to wait for 5 years, 6 years, and hoping for the sky to fall, then I guess then there's no career progression, and then you also will not be satisfied. I mean, when you're so much a sacrifice, and then you only can go so far. So how? So you have certain dreams and aspirations. So when the right opportunity knocks on the door, you have to jump. You have to take the opportunity, not wait and think that and hope for some miracle to happen. Because yeah, I mean, to be honest, the career progression in the government side super slow and super halted. So even so many seniors who are well deserving for good promotions are not getting it.
Was there any internal conflict for you when you took the job in Sunway? Did you feel guilty in any form or manner?
Guilty, yeah. I mean, I would have liked to serve the government longer, actually, to be honest. I mean, but yeah, I guess maybe in terms of this thing, yeah, you can help much more people in the government side, I think, because anyone calls you, everything is free there, right? So, I mean, the thing is now when you're in a private sector, you can help to a certain extent. Of course, things are limited because of, but if you ask me overall, I have no regrets. I have no regrets. And I think I came at the right time too. So I have got no regrets, I would say.
While I was in medical school, becoming a doctor, like learning to become a doctor, I was studying. Like a lot of my perception about what being a doctor is, was shaped by Hollywood and like what you said, right? You were watching a lot of all these series. So what do you think is the biggest misconceptions doctors have about being doctors?
biggest mis- the biggest misconception I think is that all doctors are financially very well. Don't think that way. That is the biggest mistake. You may be known as a consultant, but trust me, the pay is not very great. Okay, but I guess yes, many people are doing it for self fulfillment and happiness and all that. It's not about the money. That's one. But the second misconception is that it's a very glamorous job. Oh, I'm a consultant. I go. So you go, you see Grace Anatomy and all these things and think that life is like that. Nothing like that. Okay, it's a lot of self-sacrifice and lot of sacrifice from family time, personal time, whatsoever. It's not like other jobs whereby you clock in at 8 o'clock and you clock in at 5 o'clock. Sometimes patients come in and ask, Doctor, you never go for lunch. Ah?" I said, how to go for lunch? You all are there. What? I have to see you finish, then only I can go. Or even they come and say, Doctor, 6 o'clock still seeing patient. Yeah, because you guys are waiting. Of course, I have to finish seeing what. I cannot say 5 o'clock my work finished. All of you go back and come back tomorrow. You are a sick person waiting outside. Correct? So there's no such thing as clock in and clock out. There's no glamorous thing whereby you are, oh, you come and do some surgery and, the bleeding is 1 liter and then you come out and then everybody praises you. No, it's like, it's a lot of this thing. It's a lot of stress also, you know. When you're dealing with difficult cases and all that stress, dealing with patients, dealing with complications which can happen, how so it's a lot of managing stress and all that. So it's not at all like what you see on the TV or what is not as glamorous. It is not financially that great in terms of this thing. Yes, people say private practice is this is much better. Yes, it's much better than the government side, but it comes with its own risks and stress, different kind of stress. Because in the government sector, we have a whole team working, and there's so many levels of check and balance. Here, you're all alone. Okay. Yes, certain complex cases we do it as a team, but most of the time or every time you see a patient, you diagnose, you manage, you operate, you discharge, you follow up. Everything is on you. So that stress is more. Did I miss something? Is it possible that I could have missed something? For that, your knowledge needs to be on par so that you don't miss. Yeah.
I think a lot of people don't
No.
see that. I mean, as doctors practicing in the government, you take for granted that there is a team.
Yes. You're right. Yeah. So I mean, people say private practice more lucrative. Also, still every day of the week you have to work. You haven't have to do rounds on Sunday. In fact, I just did rounds in the morning before I went to church. So it's not like Sunday you're lepa. I mean, in government, even you work so hard, Sunday you still can if you're not on call. Lah. So Saturday, Sunday, you have your. Here, no, you still work. You don't work, there's no this thing. That's all. So you have to work for you. Yeah. So, I mean, everything comes with its own purpose. It's, at the end of the day, it's what you want in life. What exactly you want to achieve. What are your dreams and aspirations? And chase your dreams and aspirations according to what's suitable for you and your family. So, I mean, let the haters be haters. Like, people can say, oh, this guy left government service just for the money. Or you say, la, I know my reasons. If you come and ask me or I have a conversation with you to actually explain myself, when I explain you, I know I have spoken to people who had that and spoke behind my back about that. But when I actually explain the situation, then they get it. So it's all about perception. People can think different things, but you reach a certain level of maturity, then you don't give a hoots what people say. So because then when you're younger, you always, oh, yo, what will this guy say? What will that guy say? What are people perception? Even the Indian culture also, they say Tamil, they will say what the four people say. There's a Tamil saying. It's like everything also you're worried about what other people saying. Then you cannot live your life. You have a dream, you have an aspiration, you go for it. That's it.
So when you joined Sunway Medical Center, so there was an incident with you, the security guards, and the car. Can
Okay.
you
Interesting.
tell us about that
You
story?
really want me to share? Okay. All right. So, yeah. So when I came from the government sector, I was still, when I came back from Australia, because before that I sold my car and all that, went to Australia. So we had the family car, of course, but then I was actually driving a Myvi. Okay. So I was driving a Myvi because it's very convenient to drive a Myvi. And don't think life is very glamorous as a consultant. Yes, I was a consultant in HCare, but I was driving a Myvi. Anyway, so even in the HCare parking lot itself, my one only Myvi, everybody had something from Honda Civic City above. So that time I already felt it, but I didn't do anything. When I came to Sunway, when I parked in the doctor's parking, the security guard came and asked me, because the first 6 months I was here, I was still driving my Myvi for the record. So I didn't straight away come private practice like people say and then say, oh, got money, so can buy big car. No, priorities. So I was still driving my Myvi and I was stopped by the security guard in the parking lot. Doctor ga, betul ga? So I had to prove himself. That had happened numerous times. I had to show him my ID basically to say that. Therefore, probably wondering why is a consultant here in Sunway driving a Myvi. Yeah, but so only after 6 months I changed my car. So yeah. So but yeah, I thank God for that. But it's a humbling experience. So I always share this with my friends and they always have a good laugh. But I'm not ashamed to say that it's okay. So when I took my loan for my new car, the Maybank officer also she came to sign the forms in my office in my clinic now, and she also was shocked.
Okay, so you've been in the government practice for like 19 years, right?
Yeah,
So you've probably seen, well, the houseman would have had a child that grew up
yeah,
to become a young adult already. So over the years, have you seen any changes in the quality of doctors coming in?
yeah. I mean, of course, with time things change, right? People change, things change. So you cannot expect everybody to be same. That's why I never use the line. Back in my time, I used to take care of 50 patients. Now you guys 5 patients, so you're making noise. No, I never use that line. Things change. Everybody else is evolving. So obviously people change. Personalities change. So the newer generation, that's why you have Gen Alpha la, Gen Z la, all that, right? I mean, now seeing all the Gen Z, even my kids and all that, everything one short form, some all kinds of words and all that, which I also don't understand. Anyway, so you have to adapt lah with the change. So you cannot expect the houseman nowadays to have the same personality. And somehow nowadays, maybe more pampered and all that. Parents have been doing a lot of things for them. They all socially, socio-economically, probably even more well-to-do everywhere. Driver, tuitions, and come, everything, right? So very, very luxurious. When you come suddenly, you have to be subordinate. You are lowest of the food chain. You have to listen to everything. There, back home, you are a king, queen. So yes, of course, there will be some sense of thing. But I think right attitude, if you have, okay, right receptive attitude to learn and to move with the crowd. I've seen even very, very rich, socially affable housemen who can actually toe the line and work very effectively with a team and all that. They got no issues. So it's all about one's attitude. Definitely, if you ask me, they have changed, yes, to a certain extent. Because generations change. Now everything is social media, this, that, everything. And people talk about work life balance a lot. And then too much of fake thing on the social media so gives them a delusion of grandeur. Oh, I can just work 5 days a week and 2 days or 3 days and then have a nice, I go on the cruise and I'm on the ship chilling out Hawaii, this, that. Yeah, that's what is shown on social media, but what is really happening, that is not work life balance. In the initial stages of your career you need to work hard, then only you can achieve the fruits of your labor later in life. So work hard, have the right attitude. So as long as they have the right attitude, things would be smooth. But if you ask me if they've changed, many have changed, yes. But there are also good ones. Okay, you cannot just say all Gen Z Alpha are not good or what. There are good ones with good potential, good new talents, all we see. Yes, and they can work when you actually lead them in the right path, they can work.
Do you think it's because there's like no more bar of entry? The moment you can pay, you get into med school. So it's no longer the cream of the crop that's becoming doctors.
Yeah, it depends where and what. Yeah, to a certain extent, yes. If they have a lot of medical colleges and all that, then things crop up, they pay and they come and all that. But as long as legislation is there, rules are there, you have certain criteria for you to become a doctor. Because I think I have had housemen who have come from non-recognized universities those days, all from Ukraine and all that. Even the initial batches of from Ukraine those days, before they got de-recognized and all that, some of them have told me, but they have the right attitude. They want to learn. So some of them, they learn entirely whatever in housemanship, but they have the right attitude. So okay, I think most of them when they come for housemanship, they will already to be a certain extent on par with this thing with others, and it's just about having the right attitude. But like you said, definitely is easy entry due to money and all that is there. That's why too many medical schools. But the legislation, when they come out, the rules, criteria to pass and all that needs to be strongly enforced. That's for sure. That's why
What
some
is the right? What is the right?
right attitude for housemen to have. I mean, junior doctors. Like I said, being receptive and being accepting of correction or learning, being like a sponge, this thing, not everything that means, and also flexible. Timing is flexible. You are adaptive of when people tell you something constructive, you take it. Criticism, you take it. You want to better yourself, not show attitude, or you say this is my timing, I've always been like this, so I don't no change, not adaptable. So if you have that kind of attitude, teachable attitude, basically.
Okay, so now throughout your career, you've honed your craft as a surgeon. You've also shaped countless medical officer and housemanships lives under your mentorship. Like, what's the legacy that you want to leave behind?
Legacy, huh? Yeah, legacy. Like I said, I aspire to inspire. if okay, so yeah, so I think legacy wise, I want to be one of the advanced robotic surgeon who is well known in the region, of course, in so to and also to be well known among my patients and all that, but also to be able to actually inspire the young generation to look at the entire journey as an inspiration, and to have the resilience and the persistence and the perseverance to actually achieve your dream. I always feel if you have a dream, pursue it, achieve it. You know, in line with whatever you have to do. If you have a dream, another thing is passion is important. See, when that means every day when you go to work, you don't have to drag yourself. You are passionate about what you do. So then all the extra things doesn't bother you already. You have to stay extra, or you have to operate at 2 a.m. or 3 a.m. in the morning, you're tired or whatever thing also. It doesn't bother you because you're passionate about what you do. You're passionate about healing your patients or getting your patients this thing. You know, like for example, I want to share like the other day did a hip replacement for a patient, and then the patient's 9-year-old daughter wrote me a card. I came very stressed out that day because so many things to do, rounds and all the thing, and then I have to rush to OT clinic. But I saw that card, my heart just melted and I just softened. The girl wrote, "Thank you for healing my father." So, and for a while I was like, damn, I'm not God to heal your father. God healed your father, but I'm just a I was just a tool, because the father was suffering with agony of hip pain and all that. And then, doing a hip replacement, a very rewarding surgery. When they walk the next day and then they're happy, they're pain free, rewarding for surgeon and for the patient. So when the daughter writes something like that, when you see it, wow, it just made my day. A simple, like a small little card, thank you for healing my father. That made a big difference. So I mean, this is the things, when I see all these, when I see my patients do better, it gives me a sense of purpose, as to I'm doing the right thing, like at least somewhere out there I'm doing the right thing, and this is my calling. I'm living my calling, and I'm passionate about what I do. That it gives me the drive. So that is the legacy which I want to leave even with the juniors. Don't give up. Chase your dream. It took me 23 years to reach where I am today. 23, 19 years in the government, total 23 years of work and study to reach where I am today. And look very bleak here and there along the journey, but 23 years before I could.
Which which part was the toughest, you think, that could be mentally, emotionally, or physically? Which part of the whole journey was the hardest for
The
you?
masters and the subspecialty part, which means that 2004, 2010 to, yeah, that a good 9-10 years from 2010 to 2019, 2020, yeah. Yeah, that period of the masters and the subspecialty, that the most, yeah.
Did you failing your subspecialty affected you like mentally or emotionally or
Yes, a lot.
in any?
Yeah, a lot. Because, the head of the subspecialty, after my exam, he gave me a call and then said, "So, how do you think you did?" And all that. I said, "I also not sure. I was like lack of sleep and all." Then he told me, "Anyway, they think that you're not ready. Maybe 6 months. Okay, fine." Then I said, "Oh, I'm devastated. Like, why?" I was asking what. Then he said one thing. He said, I know why you feel this way." I said, "Why?" He said, "Because you have never failed an exam in your life." Then that hit me. It was true. Since standard one from Tadika also, I've never failed an exam. So when this particular thing happened, it was a tight slap on my face and a hit at my ego also. And also it brought my confidence down and saying that, because you think that you can never fail an exam, but probably God was trying to teach me some humility also lah, to a certain extent. So everything I told you, everything happens for a reason, right? It's not like you can talk all about fairness, not fair, not fair. I can argue the questions were not fair. They will justify the questions were fair, whatever lah. But maybe it was a humbling humility. It's a lesson on humility, humbling experience. You have never failed an exam. Now look at the FAIL as first attempt in learning and push through. If you give up, that's it lah, the end. No more career. I mean, back to square one. But if you don't give up, you see the light at the end of the tunnel. Now, retrospectively, you can say, lah, you know, it was good, correct timing and all that.
So, what's your last words for young doctors who are listening? They could be at a crossroads, they're not sure of their path, or they're facing setbacks. Like, what would you want them to take away from this whole conversation?
Yeah, I think the take home message should be resilience and perseverance. Don't ever give up. However, everybody has their own path. Life is a journey. Everything happens for a reason. Sometimes not according to our own desires or dreams. Sometimes our path is weird, but don't give up. Have a strong support system. Make sure you got good friends, family around you to actually advise. Get different opinions and advice from people who are more senior to you, or even friends or somebody who have gone through similar parts or different parts. Get some opinions. Sometimes you'll get that eureka light bulb moment, like, oh yeah, maybe this is what I supposed to be doing. Yeah, so talk to a few people. Sometimes when you're heading life very like a horse running a race, sometimes when some things happen, you need to stop, full stop, go for a holiday somewhere, think first, what am I supposed to do? Maybe go take a 1 week break, forget about everything, shut your brain off, relax, think. Then you'll get new perspectives, new things. Don't just make decisions very rashly. And sometimes family will say this, they say, oh, you studied already so much, you want to do this or you want to do that. But don't take negative perceptions and then to let it kill your dreams. Go forward. When people I experienced it. When my father passed away, some people, my family, all told, forget about masters. Just open a clinic. We will support you and all that. And you just stay near your mom and open a clinic. But if I listened to them that day, I would be forever regretting I never became an orthopedic surgeon or arthroplasty surgeon. But I refused to listen to the negative comments and chose to chase the dream. So chase your dream, chase your passion. If you are passionate about something, don't let anything stop you. Okay? A few setbacks will come, but sometimes setbacks, I told you, it is some sort of maybe a comeback, set up for a comeback. So don't give up, be resilient, persistent, and chase your passion and dreams. Do not ever give up. There's so much of opportunity out there. There's so many things you can do. It doesn't mean one path only for everyone, right? But always have a good support system and talk to people. You have a good support system. Don't drown yourselves in the sorrows and just be in a cocoon and so be open about things.
Okay, thanks, Dr. Jeffrey. So, guys, if you're enjoying this conversation and considering exploring new career path, be sure to check out our non-clinical Pathfinder workshop at Disruptive Doctors, and also check out our annual Disruptive Doctors Healthcare Disruptors Conference that's happening on the 20th and 21st September, where like-minded doctors like you come together and share ideas and impact healthcare differently. Now, this wraps up another episode of Postcall, Stories Beyond the White Coat. Until then, I'm Dr. Selina. Take care, keep disrupting the norm.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.